WOCA.com.
The most trusted name in news, Fox News, every half hour, only on 96.3 FM, 1370 AM, The Source.
All right, 20 minutes after 9 o'clock. Thank you for tuning in. It's really cold up north, but right here, 50 degrees. That's why you moved to Florida, right?
Yeah.
I was reading something this morning to prepare for this next segment. About 40,000 children are born every year with heart defects in the United States. That is scary. That is just, maybe it's not a big number when you consider how many people in the country, but if it's your child, that's all that matters, right?
Oh, sure.
Dr. Elizabeth Saarel is on the phone. She's with the department. She is the department chair of pediatric cardiology at the Cleveland Clinic Children's Hospital. I bet it's cold in Cleveland right now. Good morning, Dr. Saarel. How are you?
Good morning. I'm doing well.
Are you in Cleveland right now?
I am, and you're right. It is cold. It's about 20 degrees. But not snowing at the moment.
Oh my goodness! You've got so many medical providers up in Ohio that seem to be where we're all going to. You seem to be the place to go, Ohio, for medical issues.
Actually, yeah, we are lucky in Ohio. We have a lot of excellent medical centers, including the Cleveland Clinic, which is particularly known for heart disease, ranked first by U.S. News and World Report for the past 21 years.
What does the word congenital actually mean?
So congenital means existing at birth. So a congenital heart defect is any problem with the heart that was present when a baby's born.
Oh, really? So if you get diagnosed at 60 with congenital heart something, you had it all your life.
Yeah, exactly. In fact, I just saw a 50-year-old last week who just was diagnosed with something he had his entire life, but never previously had symptoms.
Oh, really? Like, what would the symptom be? And if it's congenital, it doesn't define necessarily what exactly is wrong, right?
Right. Congenital just means it's there since birth, and the range of problems can be very mild to very severe. So, for example, the gentleman I saw last week had something towards the milder end of the spectrum, and that's why he didn't really have symptoms till he was older, and his symptoms were related to decreased ability to exercise.
So do we look for these things now at a very young age to maybe nip it in the bud?
Yeah, we do. We actually try to screen for the problems before birth. So when moms get their prenatal care, part of the care is an ultrasound that the obstetrician does in the first or second trimester. And there is some screening done by the ultrasound looking at the baby's heart. And if there are concerns, then they're referred on for more detailed screenings in the fetal cardiology clinic like we have in our pediatric cardiology department. But some minor defects can be missed. They're hard to see on these prenatal ultrasounds and may not necessarily have signs or symptoms right after birth, although the more severe forms of congenital heart disease do show signs and symptoms in the newborns.
Is there an operation that takes place right away after the baby is born and then it is discovered right away, or does the baby have to grow a little bit before the operation can happen?
That's a great question, and the answer is yes to both. So for the most severe forms of congenital heart disease, the baby won't survive unless we do an operation right away.
Oh.
So that happens in some cases. In other cases, the malformation of the heart is less severe, and the repair that we can perform may be more ideal if the baby's bigger, because when the baby's born, the heart's the size of a walnut. And babies double their birth weight in the first 6 months of life. And so the heart doubles in size over 6 months. So for the babies who don't require surgery to survive, we try to wait till they're a little bigger for a lot of the repairs we do.
Wow. Yeah, we've been hearing about the Zika virus affecting pregnancies, and alcohol has always been known to affect pregnancies. Are we learning more now about what might cause heart conditions before, like when the baby is not born yet?
Yes, that's a great question, and there's a lot of research that we're doing in that area. like you said, sometimes there are external influences like toxins or viruses that can affect heart development. In some cases, it's also genetic, so they can inherit the tendency towards heart disease from parents. And in most cases, it's complex inheritance, meaning multi-gene defects. So it usually requires more than one gene to cause a heart defect, and we're still doing a lot of research to try to learn about that.
Now, when the mother is found to be pregnant, then, and if she can't afford a regular doctor and she goes to the free clinic, is this kind of practice offered at the free clinic as well?
Yes. The good news is this type of practice is offered by all forms of health insurance and free clinics. So this is part of routine obstetrical care, where the babies get a prenatal ultrasound, and that's standard. For follow-up for pediatric cardiology, again, most families and mothers are eligible for some form of health insurance, and all insurance covers care for congenital heart lesions.
Oh, wonderful.
Does the doctor or the surgeon approach it differently if it's congenital? The 50-year-old guy that you were talking about, it sounds like was from birth, but what if he had got a condition similar a year ago? Would it be treated differently?
In this case, there's no way this condition could have come up a year ago.
Oh, okay.
There are some valve problems that can develop as we get older, and the surgical treatment for what we call acquired heart disease is very different than what we use for congenital heart disease. But in the case of the gentleman last week, we have to screen him for both. So we'll treat his congenital heart disease, but we also have to check him out to see if he's acquired any heart disease related to, clogging of our coronary arteries. So we have to do a lot of testing before surgery to make sure we treat both conditions if both are present.
So this is a kind of a way out question, so forgive me if I'm just being too science fiction minded, but when we hear that stem cells can regrow things that have gone bad in our bodies, if we were to use stem cells for something that's congenital, would the same congenital problem be reproduced?
That is an excellent question, and the answer is I have no idea.
We don't know, huh?
No, and that's a huge area of research. If it's genetic, and the reason the genetic heart defect developed was the cells are programmed incorrectly and to form, to malform the heart, then the answer is the stem cells would grow that heart again with the same defect. However, we think that most congenital heart disease is multifactorial, and it depends on which genes are turned on at what time, and also environmental factors may play a role. So it is possible that stem cells could grow a new heart that was not malformed.
Wow.
And there is research going on in that area as well.
The folks who are listening right now who are most interested are probably the parents of children who have already been diagnosed with congenital heart issues. Do you have any good news for them, or any information that you can send them to, like a website or a book?
Yeah, well, the good news is that we have excellent treatments available in 2016. We have a website here at Cleveland Clinic. It's clevelandclinic.org/children that has some good information. Also, the American Heart Association has an excellent website and has external links as well for more references.
Doctor, thank you for being on the air with us today. I just looked up the temperature in Cleveland. Not that you need me to tell you, but it's 23 degrees there. 52 here. Just trying to rub it in a little bit.
Thanks a lot.
Thank you for the information, Doctor. We'll take the interview we just did, and we'll make sure the recording goes on YouTube and on Facebook, and the links and the websites will all be included. Dr. Elizabeth Saarel, thank you for what you've chosen to do. You're making the world a better place.
Thank you.
Thank you. All right, we'll take a little break, and we'll be right back.
Fox News Radio, I'm Pat O'Neill. A political battle shaping up following the death of Supreme Court Justice Antonin Scalia. President Obama says he'll nominate a successor.